Considering the vast amount of complicated information, including an intimidating number of drug names, I am sure you have wondered if there is a best way to study pharmacology. You probably have heard several tips and some tricks from your professors and colleagues. Studying pharmacology effectively definitely requires a structured and active learning approach. I asked ChatGPT to summarize the best way to study pharmacology, and here's a comprehensive strategy. Let's discuss these top tips one by one. I really cannot emphasize this enough. It is extremely important that you build a strong foundation. This starts with understanding the basic physiology. Know the physiology and pathology of organ systems, as they provide context for drug actions. For example, understanding the autonomic nervous system helps with drugs acting on adrenergic or cholinergic pathways. This way, instead of just memorizing hundreds of drugs and their actions, understanding the associated basic physiology would make it easier to retain the knowledge of their drug actions easily. To facilitate this process, make sure to learn the mechanisms first. Focus on how drugs work rather than memorizing names. Group drugs by their mechanism and effects to simplify learning. On a similar note, organize your learning. Use drug classifications. Study drugs by classes, for example, beta blockers, ACE inhibitors, as they often share mechanisms, indications, and side effects. Studying pharmacology effectively definitely requires a structured approach. Therefore, create a study framework. For each drug, focus on mechanism of action, therapeutic uses, side effects, adverse effects, contraindications, key interactions. Use mnemonics and memory aids to facilitate retention. Develop creative acronyms and mnemonics to remember drug classes, side effects, or mechanisms. Use visual aids like flowcharts, diagrams, and tables to summarize complex information, as pharmacology often involves pathways that are easier to understand visually. Utilize active learning techniques. Use physical or digital flashcards to review drug names and mechanisms. Explaining concepts to a peer or writing summaries forces you to solidify your understanding. Also, use pharmacology-specific question banks to test your knowledge and reinforce clinical application. You can visit shorts on this channel to practice MCQs. Try relating drugs and pharmacological facts to clinical scenarios. For example, beta blockers for hypertension or arrhythmias. Case studies or problem-based learning is highly effective. Leverage all available resources. While user-friendly pharmacology textbooks are surely the best way to start learning pharmacology, utilize several other resources like videos and websites. In addition, discussing and quizzing with peers also enhances understanding and retention. Regular review further strengthens the newly learned information. Schedule periodic reviews of older material to avoid forgetting. At the end of each week and month, summarize what you've learned and revisit it before exams. Also, do not forget to stay updated. Pharmacology evolves with new drugs and guidelines. Therefore, stay informed through reliable sources like FDA updates or clinical journals. Focusing on high-yield topics could help relieve anxiety about too much information. Therefore, start with drugs frequently used in practice. For example, antihypertensives and antibiotics before diving into less common ones. Another way is to start with the top 100, 200, or 300 drugs. Last but definitely not least, take care of yourself. Adequate sleep, proper nutrition, and exercise are essential for cognitive function and focus. Pharmacology can be overwhelming. Use stress management techniques like mindfulness or short breaks during study sessions. I hope this helps. I wish you all the best in your journey. Do not forget to subscribe for future videos and like if you feel you were helped.